So Eric, I would like to, hear from you because Michael just shared about how it's important to communicate correctly with the staff, but also how do we, communicate about safety? So, for example, there might have been so many changes in the organization. There might be changes in local travel policies, or, like I shared, whether we encourage people to travel because the work demands it, or, think of staff safety in the first place. And if there are things that cannot be like neglected, it has to have travel, then how do we communicate these things to the staff? So basically, how do we communicate about safety to our staff? Over to you, Eric.
Great, thanks, Meta, and thanks for having me on this panel. This is an exciting topic and, of course, very timely. So in terms of communicating with our staff, we've had a few ways of doing this. We have had regular weekly coronavirus Q&A calls where all staff are invited to participate through a big Zoom meeting. We have on staff, we have a very experienced public health expert who will walk through with people the latest public health news related to COVID. We also have on that call our safety and security officer who will discuss any issues surrounding safety and security for staff. And we have myself on the call who talks about any operational issues or policy issues that are coming up. And so that's one way that we have managed the communications with staff. We've also every week followed up that Q&A session with an email from me for anybody who wasn't on the Q&A calls, and that goes out to all staff to explain to them what the summarizing basically the call and any other information that we need to convey to staff. So those are the two main ways that we have done it. We've also, just in terms of some of the things that we instituted as part of COVID, we early on decided that we wanted to institute something we're calling pandemic time off, which allows staff who are dealing with child care or elderly care, or in other ways are unable to work because of the pandemic, to take up to 2.5 hours a day and build that time to what we're calling pandemic time off, so that they can take care of their personal lives and take care of the things that are important to them, so that they can and still continue working without having to take their own leave time. And we've also been very upfront about letting people have as much flexibility as they need to do their jobs. A lot of people are working a longer total amount of or a longer period in the day, but the same amount of hours in the day. Or some people are working on the weekends instead of during the week, just to allow them to take care of family and schooling and everything else that has to do with their job. So anyway, those are just some of the things we're doing, some of the things that we thought have been helpful for communication to staff.